Hi everyone, my name is Rachel Sun, and I go to Brookfield Academy in Wisconsin. Um, and I'll be presenting a comprehensive mobile application to monitor and enhance kidney health for dialysis patients using machine learning. And before I start, I really want to thank the conference and the session organizer for making this wonderful event happen. Current global kidney health. Approximately 850 million patients are facing various kidney issues, while 1/10 of the global adult population are experiencing CKD, chronic kidney disease. With a substantial occurrence rate, kidney failure progresses to be more widespreading and frequent rising with age, with 949 annual cases per million for ages of seniors above 80 and below 89. So why develop an application like this? The inspiration behind the creation was a personal connection to a beloved family member, my grandmother. Witnessing her journey and the challenges she faced while undergoing dialysis treatment for 8 years significantly fueled the drive for me to not only make a difference in her life, but also in the lives of countless other individuals who find themselves in similar circumstances. We realized that my grandmother's battle with kidney failure highlighted the struggles that many seniors face while dealing with such a critical health condition. It revealed the certainties inherent in the management of kidney health. The frequent hospital visits, the continuous need for rigorous monitoring, the sole reliance on established treatment systems not only places a costly and high financial burden on their patients and insurance companies, it also creates an issue of resource inaccessibility and medical scarcity. The expense of daily dialysis and the relative inaccessibility of current methods to track kidney health can potentially worsen present conditions for dialysis patients. In some poorer countries, many patients even die at an early stage due to lack of timely treatment. We decided to propose a solution to this. A comprehensive mobile application developed to empower patients undergoing dialysis treatment, integrating an AI algorithm trained through machine learning, which is dedicated to monitoring and improving kidney health through advanced statistical data analysis. This AI system operates in harmony with its patient's doctor, bridging the gap between patient and healthcare provider to enhance the efficiency of medical decisions pertaining to kidney diseases. One of the application's primary objectives, and the most important objective, is to detect the presence of anemia within a patient's body, a common concern for dialysis patients. We decided to improve upon existing approaches that are already out there. For example, GKHA, which uses data collection methods such as surveys, and is a really effective approach into monitoring kidney health like us. However, they have the limitation of lacking personalized patient care. And we decided to improve upon this limitation by offering personalized analysis for each individual using our application. And another approach would be mHealth, who mainly strives to manage CKD, chronic kidney disease, through also offering an application like we do. However, they have a limitation as specific biomarkers that they use are overcomplicated and creates a lot of confusion the for patients undergoing dialysis, especially seniors who aren't as don't really know how to use complicated biomarkers as much. And our improvement is that we significantly simplified our prediction scales, which and we shortened it only into 4 of the most relevant parameters and indicators, including red cell, white cell, and hemoglobin and packed cell volume, which are the most important factors in determining anemia. And another approach would be the heart rate smart wristband, which uses wearable tech, a wristband, and management platforms, as well as connection with social media to monitor kidney health. However, they have the limitation that because they offer wristbands, there are only certain amounts of wristbands that can be distributed to dialysis patients, meaning that there are device availability limitations. And we decided to improve upon this by only using the application, which means that there's unlimited access to all patients anywhere and anytime, granting convenience. So this code shows how to use machine learning model in a health app. The predict anemia function takes a user inputted blood data, scales it, and predicts anemia risk using support vector machine. Last helps set up the application, handling requests for the data. The machine learning part uses cross-validation to pick the best model for accurate predictions for anemia. One of the major experiments that we carried out was accuracy. Evaluating accuracy involves using Python's cross-validation library with Kaggle data, splitting it for training and testing. The accuracy section was a really important part for our application because having an accurate prediction is really important to give timely and efficient and strong insights to dialysis patients. And the results show that XGBoost outperforms others. And this experiment emphasizes the effectiveness of advanced models, highlighting their impact on accuracy and reliability in predicting dialysis need. Another really important experiment that we carried out besides accuracy is program speed, because it's critical for providing timely data analysis during renal dialysis, ensuring accurate treatment decisions. The experiment evaluates the time efficiency of the AI model for anemia predictions in renal dialysis patients. Findings suggest a correlation between data complexity and processing time. And this tells us the need to optimize AI model and data handling procedures to make rapid, timely decision-making in clinical settings. Application starts with a login screen where authors authenticate themselves. Once logged in, they reach a dashboard which serves as a critical hub for accessing various features, including the anemia prediction function and the renal care track, the two main functionalities of the application. Upon downloading the app, users are guided through a simple registration process, ensuring their data is securely stored and accessible only to authorized users. Once registered, users can begin utilizing the app's two main functionalities, the renal care track and the anemia prediction. In the renal care track, users can enter vital information such as blood pressure, phosphorus, potassium, and other relevant indicators. Moving on to the anemia prediction function, users insert only 4 values. Users can go on to press the Analyze button as soon as they have entered the 4 values and will receive an instant yes or no response. Propose objectives for future development. So for the system to examine statistic more accurately than it is right now currently, more data points could be applied to the machine learning section. Besides just red cell, white cell, hemoglobin, and packed cell volume, we could also expand on methods to solve the issue of discrepancies in AI predictions by adding more columns of traits to test for anemia, including sections for iron profile and B12 vitamin levels, because they're also really vital in determining the presence of anemia in the process of future dialysis. And to conclude, our application renal dialysis integrates AI for kidney health monitoring. It assists in tracking treatment through processing data monitoring, and enhances medical decision making, bridging the gap between doctor and patient and increasing their collaboration and medical efficiency, and ultimately provides timely insights for proactive condition management for both the patient, their families, and medical providers. Here are my works cited. And thank you so much for your time. And here's my contacts.